Hi everyone, and welcome back to another episode of GP Notebook TV. Lisa Devine is my name, and I'm a GP in Wicklow in the Republic of Ireland, and this video looks at a fascinating article published recently in the high impact journal JAMA. The article goes through a new WikiGuidelines group consensus statement and is titled Guidelines for the Prevention, Diagnosis and Management of Urinary Tract Infections in Paediatrics and Adults. So my first question when I saw the article was, who are WikiGuidelines? So I had to go off and look them up. And as it turns out, they are an international not-for-profit group seeking to develop evidence-based guidelines in medicine. And in May 2023, they solicited new and existing members for questions on urinary tract infection prevention, diagnosis and management. And then they went on to conduct a review of nearly 1,000 papers on the subject. Their reviewers were quite extensive, so they had 54 experts from 12 different countries, and the group comprised 31 physicians, 23 pharmacists or PhDs, and all of the reviewers had expertise in internal medicine, paediatrics, infectious diseases, or microbiology. In their introduction, the authors start by noting that urinary tract infections are among one of the most common infections globally, notably impacting patient quality of life and posing substantial clinical and economic challenges. Urinary tract infections, as we know, come in all shapes and sizes, from the simple cystitis to pyelonephritis and even life-threatening sepsis. Diagnosis, as we know, can be a challenge due to the lack of validated, highly accurate testing, and management is further complicated by evolving multi-drug resistance. The article is vast and covers lots of different topics, but in this video I'm going to pick out a few interesting practice points on urinary tract infection prophylaxis and prevention, where they looked at what products do and do not have evidence to support their use. The reviewing team looked at several hot topics in UTI prevention, such as the role of antibiotic prophylaxis, cranberry juice and supplements, water intake, topical vaginal estrogen, methenamine hippurate, D-mannose, and the use of probiotics. Two of the strategies which showed the most positive results included the use of cranberry products and topical vaginal estrogen. When it came to the use of cranberry products, there was enough high-quality evidence to provide a clear recommendation on the topic. Most of the prospective studies, in fact, indicated that cranberry products can reduce the risk of symptomatic, culture-verified UTIs in the following groups. That's women with recurrent UTIs, children, and individuals susceptible to UTIs after interventions. In other groups, such as older adults, those with bladder emptying problems, or pregnant women, there was insufficient evidence to make a clear recommendation for or against their use. But overall, I was really delighted to see the evidence supporting the use of these products, which tend to be simple and accessible for our patients. Next, the review went on to look at the use of topical estrogen in women with UTIs, and it again found sufficient quality and quantity of evidence to provide a recommendation. This recommendation was based on evidence from 30 randomised control trials and one large retrospective observational study, and they were able to conclude that topical vaginal estrogen seems effective at reducing recurrent urinary tract infection in postmenopausal women. Helpfully, they also discussed the physiological basis for this, which is that the loss of estrogen during the perimenopause causes changes within the vaginal microbiome, and this can lead to the loss of lactobacillus species, an increase in the vaginal pH, and the increase in urinary tract infections. The authors concluded that the use of topical vaginal estrogen can help to reduce vaginal atrophy, restore the vaginal microbiome, and reduce the frequency of urinary tract infections. Of course, a topic that was of particular interest to me in the review, and I'm sure to all of you, was the role of antibiotics in UTI prevention. And unfortunately, this extensive review found insufficient quality of evidence to enable a clear recommendation. What they concluded on the topic was that longer-term antibiotic prophylaxis could be considered, but the decision to use antibiotic prophylaxis must be balanced against the need for prevention and also the risk of adverse drug events, antimicrobial resistance and microbiome disruption. On this particular topic, I was keen, of course, to get a definitive answer, although this case-by-case approach, I suppose, is true to real life and reflects the complexity of modern medicine. They also specifically looked at postcoital administration of trimethoprim or sulfamethoxazole or ciprofloxacin, and they found that this may reduce the incidence of UTIs in women compared with placebo, but they weren't able to give an idea about specific regimes, such as whether a single dose of an antibiotic after coitus versus a more continuous strategy would be recommended. And again, they really stressed on this topic that a case-by-case approach is needed. For me, looking at this recommendation, I would be really inclined to follow local guidance to ensure good antibiotic stewardship. So for us in Ireland, this is available on antibioticprescribing.ie, and I'm sure wherever you are listening in from, you'll have your own local guidance, so it's worth taking a look at that. A new product for me that was included in the review was methenamine hypurate, which is a product that works by releasing formaldehyde into acidic urine, and this results in bacteriostasis. There was enough evidence on this topic to suggest that methenamine is an appealing antimicrobial sparing intervention to reduce UTIs in patients without incontinence and with a fully functional bladder. Sure enough, when I looked at our local guidance, it was actually included, so there was a recommendation there on how and when and where to consider using this product. What about that common sense recommendation on making sure you drink enough water? This is something I certainly commonly recommend. So what happened in the review when they looked at this? Well, they did find one randomised control trial that explored the effect of hydration on urinary tract infections and found that increased water intake significantly reduced cystitis in healthy women. But there wasn't enough evidence out there to make a clear recommendation on this subject, which I think is a pity because it's always nice to be able to use those easily accessible recommendations. So we'll wait and see if there's more evidence on this in the future. The last product included in the review was the use of D-mannose, which is something I sometimes see being prescribed in the urology clinics. The clinical review found insufficient quality of evidence to enable a clear recommendation on this. And this is despite a plausible biological reason for its effectiveness. So at the moment, what they said is that there is currently insufficient evidence to support or refute the use of D-mannose in the prevention of urinary tract infections, and unfortunately this was because on the topic there was only 3 randomised control trials, 1 small open label prospective cohort study and a subgroup of another prospective cohort to have a look at this. So that's another one where we'll have to watch this space. So there you have it, the good, the bad and the inconclusive on the topic of urinary tract infection prophylaxis and prevention from the WikiGuidelines group. Did this article change my practice? I have to say it kinda did. It certainly gave me an increased confidence when it came to the role of cranberry products and topical vaginal estrogen, and it also encouraged me to refresh my knowledge of our local guidelines to be sure I know what's recommended in my location on UTI prevention strategies. I hope you enjoyed this GP Notebook update and I hope you find it helpful for your daily practice. If you're interested in this, I certainly would encourage you to have a look at the article. I look forward to seeing you again soon on the channel. Thank you for listening.